Being on a hit TV show should be something to smile about, but this wasn't the case for our next guest. Let's have a look.
People may know me from the hit show Empire. I play Portia Taylor, Cookie's sassy assistant. Thank you. I'm always the one telling people, you know, be you, be yourself, do you. And I know for a fact that people will be surprised that I was subconscious about something on my body. My teeth. I have a gap right here, and then I have the gap in the front. I just want to fix these two little whatever.
Tyronda?
Hi.
Hi. So let me know what you're concerned about, and we'll see what we can do about it.
I just want a beautiful smile, that's all.
Okay, take a look here. This tooth over here that was missing congenitally, looks like your teeth have drifted in trying to close that space, but it can't close it completely. And the space is right now so small, you can't really put a false tooth in there like a bridge or even a dental implant.
Yeah.
You'd have to orthodontically kind of take those side teeth and push them all the way back and push the front tooth a little forward. That might be a little bit excessive treatment. The good news is that the space is small enough so that placing some very conservative porcelain veneers on a few teeth would allow me to proportion the teeth so that they close the spaces. So the next step would be to take some x-rays, some photographs, and models of your teeth, okay? Let's see what we can do.
Alrighty.
All right, you're pretty healthy. I like that. You're not pregnant, are you? We always have to ask that.
No.
We'll take x-rays on pregnant women or men.
What?
1, 2, 3. Tyronda, here I did on the computer imaging just to see what it would look like if we closed the gap.
Is that me?
That's you.
So when I leave out of here, I'm do like this
That's it.
and let everybody know, Dr. Rifkin
That's right. You got the Rifkin smile.
made me look like a cover girl.
As you can see there, Dr. Rifkin customized a plan of action to improve Tyronda's smile. Let's see how things went.
First thing I'm going to do is get you numb.
Oh my God, I can't reach my lips.
Now the next step is to get her gum tissue even.
I thought I was gonna have to hurry her a long time.
Exactly. What'd you say? Okay, now let's build that tooth up. Make that tooth nice and happy. We wanted to level her gum tissue just to make it all symmetrical and perfect, so we did a really minor electrosurgical procedure to lift her gums up so that each tooth was exactly the right proportion and the right level of the gum tissue to the next one. If you look in the monitor, this tooth is longer than this one because the gum tissue here is lower than this one. After that, we sanded or prepared the teeth to receive the temporaries and her future permanent restorations. We're creating a shape and a size that can receive crown or a veneer. We took impressions. That way the laboratory can build the porcelain on top of those just as we did with the temporaries.
So we're gonna cement the bun.
Okay.
Let me sit you up now.
From Fox's hit drama Empire, please welcome Tyronda Jones to the show. And before I have you explain whether or not you're happy, I want everyone to see the before and after photos because that's just what a remarkable result. How are you feeling?
I feel fabulous, darling. I feel fabulous. No, Dr. Rifkin, he's a magician. He's not even a dentist in my eyes.
He is an artiste.
He's definitely an artist. Yeah, he's definitely an artist.
And Dr. Rifkin does happen to join us here because, you know, seeing those before and after is pretty remarkable change.
Yeah.
And no discomfort?
No, none at all. Yeah, I didn't feel anything during the procedure. And then I watched him do the whole thing. I didn't want to go to sleep. I didn't want to get put to sleep. I wanted to see everything. And the drilling and the I call it the blowtorch because he was burning my gums off, but I didn't feel a thing. I didn't feel anything. And my best friend was with me. He kept saying, "You don't feel nothing?" I think he was like passing out every 5 minutes, like, "You don't feel nothing? Really?" And then he'll step out and come back in, peek in, like, "You don't feel nothing." I was like, "No, I'm good."
It's remarkable what you all can do nowadays.
Yeah.
This will last for decades.
Yeah, decades. I personally have 2 veneers myself, and I've had them for over 35 years. And depending on the patient, of course, if they clench or grind their teeth, we just got to kind of solve that problem a little bit. But if it's bonded really well to enamel, if you're really careful of how you prepare and bond the teeth, I use a microscope, operating microscope, so I can be minimally invasive. That way it's bonded to enamel, and they last. They're incredibly strong, almost like your own enamel. And they don't stain, which is the great thing about veneers. So the challenge for me was to take a beautiful woman with a great personality like this and kind of please her, make sure we could do this the right way and make it predictable. So I went through the steps of the computer imaging.
Good work done.
Whoa.
And Tyranda, you look beautiful.
Thank you. Thank you.
Best of continued success. You can watch Empire Wednesdays. It's at 9 on Fox. More to come.